Hello, my name is Kelly Malcolm. I'm with the Michigan Medicine Department of Communication, and I will be your host for today's live stream to answer your questions about the COVID-19 vaccines. Thank you so much for joining us today. Earlier this month, the state of Michigan opened up vaccination against COVID-19 to anyone over the age 16. Appointments have become much more easily available to anyone who's ready to get vaccinated. And so far, 3.9 million people in Michigan, about half of the population over 16, have gotten at least one dose. But many people have lingering questions about the vaccines. Getting vaccinated is an individual decision that everyone should make for themselves. And that's why we're here today with two University of Michigan physicians who have special expertise in COVID-19 and vaccination. We wanted to offer this live stream and the recording for people who are still on the fence about vaccination or who want information they can share with someone they love. Our experts are here today to answer your questions. And if you're watching us live, we have several ways for you to submit those questions. You can post them as a comment on your selected social media channel, or if you'd prefer to keep your question private, you can email it to ask-mishmed@med.umich.edu. Once again, that's ask-mishmed@med.umich.edu. Okay, so our experts today are Dr. Diane Harper, a physician scientist who advises patients every day in family medicine on vaccinations, and who has done research on understanding people's preferences and tolerance for risk, with nearly 300 publications on preventive care practices. In her work, she's paid special attention to how we consider new evidence around prevention. She's a member and leader of the Rogel Cancer Center, the Michigan Institute for Clinical and Health Research, as well as the U of M Center for Disability Health and Wellness. And Dr. Payal Patel, a physician in the Division of Infectious Diseases who studies infection control and hospital epidemiology. She's been taking care of patients with COVID-19 for the past year at our hospitals and at the VA Ann Arbor Hospital, and was one of the first frontline workers vaccinated here at Michigan Medicine. In fact, she's on service, so she might be interrupted. Hopefully not. All right, thank you so much for joining us, Dr. Patel and Dr. Harper. We're going to jump right into some questions. It's been about 4.5 months since the FDA gave its first emergency approval of a COVID vaccine and the first vaccinations began. It's been a year since the first clinical trials began. Can you update us on what we know now about these vaccines, both in terms of safety and also about how well they work? So who wants to take that? Dr. Patel?
Yeah, I can take that first, and maybe Dr. Harper can fill in. We have come a long way. I would say that we are really lucky and that we have not just one, but numerous vaccines that are coming in really effective. I think if you had asked us before any of these came out, how effective these vaccines would be, it would have been a dream to think that we would have kind of multiple vaccines that work this well. So that is wonderful news. And every day that we move forward, there's ongoing work and ongoing research that's trying to make sure that these vaccines are safe and effective for the people that are getting those vaccines. So we know there's been a lot in the news recently, but I would say, as someone who's here in the hospital seeing patients with COVID, I think that the safety and thinking about risk, and I know Dr. Harper is an expert in this, still that the safety and risk of not getting any vaccine and being out right now in the community really outweighs any of those vaccines that are available for us here in the United States. And Dr. Harper, I'd love to know kind of how you think about this and talk to patients about this as well.
Thank you, Dr. Patel. I think that as we have looked at the recognition that there actually was a new disease called COVID, that it wasn't just the flu, it wasn't just a bad cold or feeling bad, that the research communities have really come together around the putting together of clinical trials in a very responsible way that really was able to determine efficacy. And I think that's really important for people to realize, is that these clinical trials are the exact same clinical trials that every single vaccine I've ever worked on has had to undergo. They start with making sure that there's some kind of animal response, and that goes into then testing in humans for safety. And then that goes into testing to see, do we actually get efficacy? And then we go into the full-blown trials. And the thousands and thousands and thousands of people in the United States, as well as tens of thousands through the rest of the world that have participated in these trials, are our real heroes. They are the ones who offered to jump in and say, give it to me, take my blood, measure a response, I'll tell you how I feel. And they are the ones that we owe immense gratitude to, because they said, I really want to be a part of solving this, of being a solution to this problem. So the development of the vaccines, while it seems was fast, was done really well and exquisitely designed for studies to be able to show us whether they work or they don't, including all of the safety measures. What we see now is that the virus is kind of changing a little bit, as we expect all viruses to. And we really want as many people to get vaccinated now as they can, so that we don't allow this little virus the chance to stay around long enough for those mutations to really cause more harm. So we are really saying, let's buckle down hard so that you don't have a place to go to make more of yourselves and change into other little mutants.
Thank you for that. And that kind of hints at our next question. If the vaccines don't stop every case of COVID, is there really a point in getting vaccinated? Some people are wondering whether the efficacy is good enough, and how do these vaccines compare to other vaccines we have?
Yeah. One way that I heard about, thinking about this is really getting the vaccine defangs the virus, right? And so your chances of getting sick at all, drop by a lot, and then you passing it along to people around you. So I'll say that we're often seeing people here whose entire families get COVID. So, at the same time, your family is hit with your own self getting sick, your kids, maybe your parents, everyone that lives in your house. And so getting people vaccinated in your household not only protects you, but it protects others as well. And this is the same with when we think about the flu shot. One of the reasons that we say, get the flu shot every year is we know, and we've known for years, that if you get the flu shot, even if you get sick, you actually are much less likely going to come to the hospital, get on a breathing machine. And the same thing rings true for the COVID-19 vaccine. So I think that's how I have been thinking about it, and I've been talking to patients about it.
I will add that you look at when I talk to my patients, you look at what is the possibility of actually dying of the disease. And then what's your tolerance for that death? And then if there's something that would keep you from dying, would you be interested in it? And then would your mom or your grandma want you to be interested in it? And once we look at that, we realize that, there are a lot of different people who are involved and affected by what happens to you. I take meningitis as an example because, most of us don't get meningitis and most of us are just fine. But boy, those very few people who do get it can be dead in 3 hours. And it's such a dramatic disease. And COVID, you're not necessarily dead in 3 hours, but I've heard of some people that are dead within 8 hours of getting into the hospital from the ER. Some just stay in the hospital a very long time for the course of it. So it to me is the opportunity to avoid that, to look at what is your risk for actually getting the disease. It may or may not be very high, but boy, the chances of you having a really bad reaction as opposed to being asymptomatic are bad enough that I as much as I like Dr. Patel, I don't want to see her in the hospital. I don't want to be a patient. I just don't want to be laying there. And so I just encourage you to think about that on what your risks are, what your tolerance is. Would you rather weigh the chances of how was this vaccine for me versus what are the chances I might actually come across somebody with COVID at the grocery store, at the gas station, at the who knows where? You know, we just don't know. It'd be really lovely if all these little COVID particles would fluoresce in the air and then we could see where they were and then we could hide and run from them. But they aren't the fireflies. We can't see them and we don't know, and we can't tell when we breathe them in. We can't tell when they attack us. So I strongly believe that prevention's so much better than having to live through the disease and hope you're going to survive on the other end.
Great, excellent point. So we are hearing a lot from people who say they're worried about side effects from the vaccine, either allergic reactions or feeling really sick, especially after the second dose. And of course, the Johnson & Johnson vaccine was paused for more than a week after reports of a rare blood clot issue. What can you tell us about side effects and this blood clot issue and what people can expect from the vaccine?
Yeah, I'll share, myself that I had no side effects after the first shot. And then I had no side effects after the second shot. And, I might be lucky. My mom and my dad, we think it runs in the family, okay? Because none of us had any side effects. And whenever I've been interviewed about this, I've said, it is possible. And I know plenty of people that have had side effects. But I would say that, it's common for people to not have side effects as well. And when you're weighing, whether a sore arm versus coming into the hospital, staying here for weeks, dying, right? Leaving with, months of not knowing what's happened to you compared to a sore arm, maybe getting a day or two off of work. I think that, like the two side effects there, it's easy to weigh those two. When we think about those blood clots, I really want to remind people that COVID-19 itself is actually something that increases chances of blood clots as well. And so again, you're always thinking about the two risks. So getting the infection itself can lead to blood clots, to pulmonary embolism, which can lead to death. And that is actually very, very common. We see that a lot. Whereas we saw about 1 in a million, right, in terms of people who are getting the vaccine. And now that we have that information, I want to remind everyone that, again, you still have 3 vaccines to choose from, 2 of which have not been associated with that. So again, we have a glut of options here in America. So really, again, thinking about all those things, and I do want to share that there is a chance you may be a lucky person and not have any side effects at all. And remembering that that's an option, I think, is really important. Dr. Harper, I don't know if you have anything else you would add.
Well, so I will relate to all of the people who are afraid of a reaction, because while my first one was completely uneventful, my second one really just kind of put me on my bottom. So I understand that and that it can happen. But what I kept saying to myself, it was one day, and I kept saying to myself, this is so exciting. This means your body is fighting so hard to make antibodies, and you can just lay here in bed and sleep while it's doing that. And you don't have to lift a finger. Your body's just going to do it for you. So I will say that I agree, they're real. That, as Dr. Patel has said, not everybody gets them, and that's really good to know. But if you do get them, I just would have you rejoice in the fact that that means that your body is working without you having to do anything at creating that really wonderful antibody response. So it's, find your favorite Netflix, go, just sleep, find your favorite sheets, your favorite blanket that smells good, go sit on a chair with the beautiful spring wind blowing through your hair. Use that as your day to recuperate and just let your body make its antibodies. I will also say on the blood clots that I'm a women's health provider as well. And providing contraception for women is really important, to allow a woman to have the power over her decision as to when she wants to have a child is incredibly fundamental to being a woman. And the risk of blood clots in birth control pills have come down from where they were 70 years ago, but they're still real and we still watch for them. And yet the risk of being pregnant is much higher, with much greater rates of death than it is from getting a blood clot from taking birth control pills. So we don't talk about that. And that hasn't been in the physician one-on-one conversation a lot with women until this new side effect has come forward from COVID. And we actually didn't pay much attention to it for people who had COVID and were in the hospital. We just figured, yeah, that's part of their disease. But now that it's been listed as a possible side effect of the vaccine, we all of a sudden decided to pay attention to it. So I would say, the clown is always in the room. There is always somebody there. It's whether or not you recognize it and whether or not it's important to you at that time. And I think what Dr. Patel has said is that we have several different vaccines, and that your chances of having blood clots from other things, if you are an average person with average good health, isn't at any higher risk than any other medical intervention that you might want. So again, just in trying to measure the risks and the benefits in your own personal life for that.
Great, thanks so much. So I think some of the probably uncertainty is about the fact that two of the vaccines use mRNA, and I don't know that a lot of people know about mRNA, and there have been some rumors that it could possibly change your own DNA or change your genetic material. Is there any truth to that? And should people be worried about that?
Yeah, I get this question a lot. And one thing, I get this question a lot from either pregnant women or breastfeeding women, or someone who may be considering getting pregnant soon. And one thing that I would say that helped me understand as I was thinking about mRNA, is that the way that these vaccines work, they are really quick. Okay. So like what happens, what you get your shot, it is in and out of your system really quickly. So it doesn't have time to set up a shop and, cause crazy changes. And so that was really comforting to myself and the first group of people that got vaccinated. And now, just this week, the CDC came out with a study of like the first 36,000 pregnant women that have like gotten this shot. And luckily what they found was that, there really so far has been no changes, nothing new that's expected. I would also remember that people have been studying mRNA vaccines and how they work for years. This isn't a completely new technology. So if it's helpful, I think in like really easy lingo, I would think about it as you get this shot, it goes into your system real quick and it acts like basically you got COVID and then it's out of there. It doesn't have time to like kind of live in your system for a long time. And I think that's been really helpful when I talk to family and friends, because I say that, there's really not a chance for it to set up shop and cause these like long-term changes. And I find that that's usually a helpful way to think about it.
I really like that, Dr. Patel. That's a great way to think about it. I have been talking to the people who have worked on these mRNA viruses back in the science labs. And they have, as you said, they've been working on them for decades. And so they know about it. Just maybe as a simplification to our audience to understand mRNA, where that fits. If you were going to make a dinner because you're hungry and you're coming home from work, so it's not particularly fancy dinner, but you're going to make some kind of dinner, you'd have to go to the grocery store, you'd have to get your food, you'd have to prepare it, and you'd have to like get it together and then put it on your plate and eat it. Well, in the vaccination process, it's very similar. Like you have to get all the pieces together, you have to assemble it. It gets put into your body has to then make a protein. The protein has to react to a T cell. The T cell has to make an antibody, and then it's ready to work, and then it's ready to feed you. Well, using the messenger RNA vaccine is a lot like a frozen microwave dinner. It's already there. You stick it in, it all of a sudden is warm and it's ready to work. You're ready to eat. And so messenger RNA like cuts out many of those cell processes that have to happen in other vaccines that happen perfectly fine. Everybody gets a good meal at the end of it, right? It doesn't matter which process you go to, but messenger RNA just shuts that down so much faster. so that you can get the response made and that you can start being protected. So I just would encourage people to rejoice in the fact that science is working for them and working so that it doesn't have to take a really long time for this to happen.
So have there ever been mRNA vaccines used before in people, or is this the first time?
It's the first time.
Yeah, they've been studied for a long time, and normally, we're not in the middle of a pandemic. So, you think about how people work. We take weekends off usually, right? And we, like work at our normal pace before this last year. So if things had been normal, there would have been mRNA vaccines coming out. They've been studied and really for these very questions that people have for years. But because we had that technology, we were able to harness that technology in the emergency that we had with the pandemic and combine the powers and work weekends to get things going in a quick way. So I would say that, and I kind of love the idea that, it's better that we have technology. We don't want to be stuck 100 years ago where we were with vaccines and antibiotics. We need to use this to move forward as we continue to fight different infectious diseases. So I would say that we welcome technology in the field of infectious diseases, and we're so glad that we have these vaccines.
Thank you. Okay, so our next question, I think a lot of people are also worried about any potential long-term issues that might arise from the vaccines. What do we know, maybe from our experience with other vaccines, about when you would develop a reaction or an issue if one were to develop? And what's being done to monitor people long-term to see if there are any complications from the vaccines?
Yeah, this is a great question. We are learning more and more, actually, not about the vaccine side effects. We're learning more and more about getting COVID-19, what people are dealing with after the infection. If you think about just having a regular cold or, the flu, usually that kind of resolves on its own and goes away. There's lots of people that are talking about tons of different things that they're having, such as perhaps they're having inner ear, they're having depression, they're having all sorts of these things that are actually associated with COVID-19 themselves. And we're still in the midst of learning about that. That is actually common, right? Now, when we think about things that happen with vaccines, it's very rare, to think about in a year or 2 or 3 or 7. The only thing vaccines usually do is protect you from dying of like really common stuff. And so again, thinking about those two things, I think that, if you're someone who's like waiting, you want to, really not sure if you're ready yet, think about the kind of things that can happen. Unfortunately, if you do get COVID-19, we're already seeing with, hundreds of thousands, millions of people that have had this infection versus so far, millions of people getting the vaccine and not having side effects. So I think that's how I think about it. And there's very few things in history where we've seen the vaccine reactivate and cause harm. Rather, usually the vaccine over years really just tends to protect you until it can no longer protect you and you have to get revaccinated. So that's how I think about the two.
That was great, Dr. Patel. The history of vaccines, both in the United States and across the world, has been one at looking at when would we expect to see side effects and what is biologically plausible, what makes sense in the way we know science acts as to when we would see a side effect based on a vaccine. And it's pretty clear from over the last 100 years of work in all kinds of vaccines that the human body is going to have something in towards something not so good happen within 6 weeks, 42 days. So 42 days is the cutoff for the CDC to say this is when we would expect to see an adverse event from a vaccine. The CDC is very interested in people reporting any adverse events that they have. It does not have to be verified. You can call it in and report it. You can have your doctor call it in and report it. You can have your mom call it in and report it. It doesn't matter, but they do want to hear from you if you have one. And this is called the Vaccine Adverse Events Reporting System, or VAERS. And it's highly used. It's an important part of our public health care system so that we can, as a nation, look overall what are the possible side effects that have happened. Now, with the COVID vaccine, we've not had very many of those reported. We've had some, as you always expect, there will be some. We know that absolutely no medicine is without side effects. Somebody's going to be adversely affected from, even if you just give them salt water. If you give them too much, you can hurt them. So that we can't ever say that something's 100% completely safe, but we can say that its benefits very much outweigh any potential harms that go with it. So I really want to encourage our listening audience to know that we are interested if side effects are happening, and we want them reported. We are not brushing them under the rug. We are not pretending they don't exist. What we want to do is to be able to get adequate and appropriate reporting. So should you have a reaction to a vaccine, feel free to reach out to the CDC. It's online, it's your doctor's office, whatever, and report that, because that's how we learn how we all respond to this. So I just want to make that very clear to our audience. And then I think the other important thing along the same line to bring up that Dr. Patel will tell you more about, because I can't tell you all the details, is the fact that there is this thing called long COVID disease. And people who are infected with COVID, as Dr. Patel said, may have ringing in the ears or headaches or muscle aches and pains, or their legs don't quite work the same way and they don't understand what's going on to them and they feel afraid, depressed, anxious, lonely. And all of those are valid, but we don't have experience with that yet. So at the University of Michigan, I'm very proud to say that there is developing a particular group of physicians who want anybody who has those kinds of symptoms to tell them, so that they can both help make their symptoms better, but also learn from that and create a body of knowledge so that we can help people around the world learn what is the best way to help people with these long COVID symptoms. I think I'm going to ask you, Dr. Patel, if you'd like to make a couple of comments about that.
Yeah, I think the only thing I'll say is I get stopped in the, like, I'm like walking home from work and I'll get stopped in the parking structure all the time by like people who have just gotten vaccinated. And the most common reaction is they'll be like, oh man, I got like this spot, like this like scratch on my arm. Do you think this is like related to the vaccine? And so usually it's stuff that is very, very minor. And, you know, it is possible, you know, maybe like, you know, you had some skin changes, but almost, and I'll tell you, I've, you know, gotten stopped or called, or, you know, those things have happened hundreds of times. And that is the most common thing that I see in my practice and with my colleagues. And that usually resolves, right? On its own, it literally goes away in a week. And if that happens to you, I say the exact same thing. I say, thank you for telling me. I follow up with them and I make sure they report it to the CDC. That again is pretty benign. You're not having much pain. Now, in people who have had COVID, we are seeing, you know, really things that aren't going away, things like changes in hearing and dizziness, and those things aren't really like something you can joke about or see in a stairwell. Those are the things that we like are worried about could have some changes, you know, that could last long term. And that is something that we need to learn more about as well. So again, thinking about those two, whether, you know, maybe your hand turns a little redder for a day or two, versus having, you know, feeling dizzy for months at a time. Again, just from my experience, the few side effects that I've seen when people get vaccinated are very short term, very limited, and resolve on their own. Whereas the side effects that happen from having COVID are months long, months and months, include things like not breathing easily, being able to get exercising again, all sorts of things that change the quality of your life. So that's what I would say, just reporting here from the hospital.
Great, thank you so much. This is super informative, even for me. Okay, so we have a bunch of questions from what I would say special populations, special groups who want to know, they have their own personal concerns. The first group, people who are pregnant or want to become pregnant, or they're breastfeeding. What do we know about the effects of vaccination?
Yeah, Kelly, we talked a little bit about this, and one website that I really highly recommend for people thinking, having any of these questions, is if you can Google IDSA CDC COVID-19. There is a up-to-date website that really goes through some of these frequently asked questions. What is the literature? And it puts together just a nice set of information for people who have questions. But we talked a little bit about this, and I would say, again, trying to remember that in really layman's terms, the mRNA vaccines are in and out really quick. Don't stick around long enough to have some of the things that people might be worried about. And we now have a study, and we're going to have more studies, but we have a study of 36,000 people that were pregnant or breastfeeding during the last year that got the vaccine that are doing beautifully. And when you compare those people to, unfortunately, people who are unvaccinated and pregnant, the people who are unvaccinated did a lot worse. And so I think just remembering that what we thought at the beginning was that these were safe vaccines, and that keeps being true, and nothing has changed that. So that's really important for people to hear.
And not only are they doing really well, but the antibodies that mom makes is crossing the placenta and providing protection to her neonate, to her newborn, so that there is additional benefit, a 1-2 generation benefit from that. So I would be very encouraging that for my pregnant moms to convince them or to recommend to them that the vaccine appears very safe. They should still double mask because they are a high-risk group of people. They don't want to be getting COVID.
Right. Okay, great. So our next group are people who have had COVID. They might have heard that they shouldn't get a shot right away, or maybe that they don't need it at all. What's the guidance for that?
Yeah, I get a lot of patients who aren't sure if they had COVID, or think that they may have had COVID, but aren't sure, or that they were confirmed to have COVID and don't really want to get the shot. What I would say is that getting vaccine immunity in general for almost all infections lasts longer than the quickness of getting infected and then no longer being infected. If you have questions on the timing, this is something that I think is an easy question to ask your primary care doctor, and they can give you some guidance on when to get it. But just reporting here from the hospital, we are giving vaccines to people who are sick, who are here with other stuff, and we know that giving them the vaccine, even if they're not feeling well and they're inpatient in the hospital for something else, is better than letting them go out into the community unvaccinated. So if you think about yourself and comparing to someone who's in the hospital and not feeling their best and they're still getting vaccinated, I would think about those things, as you try to make that decision. But yeah, I think that's a really easy question to ask your primary care doctor about the timing, but my recommendation is still to get vaccinated.
Agreed.
Okay, so our next group, people who have autoimmune diseases like lupus or rheumatoid arthritis. They might be concerned about how their immune system will react to the vaccine. What do we know about this group?
Yeah, I mean, so I've gotten this question a lot. Again, this is addressed in a lot of these CDC web pages as well. If you're looking this up for yourself or for someone you love, there's a lot of information about this. What's important is that these vaccines don't decrease your immune system, right? And if your immune system is already at risk, it's even more important that you protect yourself from COVID-19 than someone who may not have that immune system issue. And so these vaccines are safe and effective. The COVID-19 vaccines are safe and effective and recommended for people with autoimmune disease. If you have questions, you can always talk to your doctor and they can give you a little bit more information. But there are very few people, again, in the hospital, we are often giving the vaccine to someone who may be here for chemotherapy or something like that, where, their immune system is really low, but we know that the vaccine will do more to help than it would to hurt that person.
So our next question was kind of answered by you just then. I think some people who have a weakened immune system are worried that the vaccine won't even work. So they're kind of on the fence about taking it. Or they're worried about
I'll
being,
just say, Kelly, with that,
yeah.
it is worrisome. And the few people who we unfortunately are seeing, of the people who are vaccinated, very few people get COVID-19 and are admitted to the hospital, right? And of those few people who have been vaccinated and have to come into the hospital, it's those with a weak immune system. And those people do better than someone who has a weak immune system and did not get a vaccine. And so, yes, the vaccine may not work as well in someone with a weakened immune system, but it works a heck of a lot better than not getting vaccinated.
I want to also interject at this point and make sure that people understand that even if you have a weak immune system, getting the vaccine will not give you COVID. Giving the vaccine protects you from COVID, and your body may not make as many antibodies as somebody else's bodies, but it'll make some. And so I just want to make it very clear that even with a weakened immune system, the chances of you having an adverse event are the same as anybody else's chances of having an adverse event. And making sure you are getting the vaccine in conjunction with your physician's knowledge, so that should you feel bad or have something go on, that person can be there to help you. That's what we as primary care physicians do.
Completely agree. And I think this can come out of, there are different vaccines, live vaccines that we would worry about, but these COVID-19 vaccines are not those kinds of vaccines.
Okay, I think we're coming up on time, but there's a couple more questions I want to get into you. Some people have heard that there might be ingredients in the vaccines, like tracking devices or stem cells or pork products that they might have obviously objections to being injected with. What can you tell us about what is in the vaccines?
I'll say X, that's a false rumor, completely false. There is no evidence of that. And people can look that up on sites that are trusted, like the CDC website, IDSA website, look at University of Michigan website, look at trusted sites, but those are completely false rumors.
And I think you will find in your in this live podcast today that there will be a reference also to a comparison of all the vaccines that are available around the world and what their contents are. And I think you'll be impressed at how few contents there really are in vaccines. They're really kind of, applesauce and mother and love. There's just not a lot of extra ingredients that aren't needed.
Okay, and I think we could probably make this last question our final one. Some people might have decided that they don't need to get vaccinated because they heard it won't change much about their lives. They'll still have to wear a mask, or there's still a chance they could get sick. What do you say to that?
Yeah, when I get asked about this, the only way that we are going to get out of this is moving the needle and getting as many people vaccinated as we can to get to a point where we can stop variants from taking over, protect everyone, protect children who may not be vaccinated yet. So, doing your part not only protects you, it protects everyone that you come into contact with, and really helps the nation come out of this pandemic better. We're not the only ones. I know I'm burnt out. I'm tired of this. I'm sure everyone listening to this is just as tired of it as I am. So this is the tool that we really have to get out of it. And that's what I would tell people who are thinking about waiting, because if you're waiting or not sure if you want to go there yet, things would only get worse if a lot of people wait. And really, the bright way out of this is to get as many people vaccinated as we can. And we're here to answer questions. Your primary care doctor is there to answer questions. We want to hear what you want to ask, but ask those questions so that you can feel comfortable making that decision.
I would just say that we all missed our summer vacations last year, and holy moly, I think we really all want to go on a summer vacation, whether it's a road trip down to a lake or whether it's, going across the sea and seeing somebody. But we can't do that safely until the world's vaccinated and until COVID's gone away. I just would put a plea out that everybody wants to hug everybody again. And we really want to reconnect as human beings. And we can only do that safely without killing each other if we get vaccinated and pay attention to wearing masks and washing your hands, and people you don't know, still stay away from them, just like mom tells your 3-year-old. So,
Can I sneak one more question in here for the parents watching? What are our prospects for actually getting kids vaccinated? I think a lot of people are worried that we're not doing a lot of good if we're not vaccinating our children as well.
those trials are ongoing.
Yeah, I think that lower number, we started in April, 16 and over, everyone was able to get a vaccine. And that number is just going to keep going down. I think the next group will be 13 to 15, and it'll just keep going down and down and down. If you have a baby these days, your child is vaccinated for the flu by 6 months or less. And so we're going to just keep seeing that number go down. And as those age groups increase, things will become safer and safer. So I would say it's encouraging news for parents.
Great. Okay. I mean, we could probably do this for 2 hours. There's so many more questions. In fact, maybe we'll do another one because I feel bad. We haven't even scratched the surface for this. But thank you so much for joining us today. And if everyone listening, we are recording this, so you can watch it later or send it to your friends who might still be on the fence. And have a great day.
Wonderful.
Thank you.